Hey, hello and welcome. It looks like we are just getting started here as we reach the top of the hour and open up today's session. To all of you who've been waiting in the waiting room to be here, welcome. It's good to have you. You can see here on your screen, you've reached the Imperial College Business School Executive Education Program informational webinar. This is a pre-enrollment webinar where we're going to learn all about this upcoming course, Digital Transformation in Healthcare, Innovation, Strategies, and Processes. As we make our way through this next hour or so together, we're going to be touching on two key themes here today about this program. Firstly, we're going to be learning all about the content. So what's the curriculum? What are those learning objectives? What do you expect to take away here from the program? The second thing we're going to be doing is learning all about how that content is delivered. So what is the experience like? What is that day-to-day experience? So kind of the what and the how are the two key areas we're going to be touching on today. I'm very pleased to have all of you with us here. You all are the stars of the show. So thank you to all of you for being here. Let's go ahead and jump in. Firstly, welcome to each and every one of you. This is a picture of campus here, Imperial College London. We're so pleased to welcome each and every one of you to this learning community and have a lot in store here for you in this program. Here today, we're going to be talking about Imperial. You'll learn more about this school, sort of the call to action, the mission to really have a transformative impact on society and on your organization. So we'll talk about that here to set the stage for our learning. From there, I'll hand over the spotlight to your course faculty who are both here with us today to tell us all about this program that they've designed. They're going to tell you all about what you're going to learn in this program, those learning objectives, some of those tools, technologies, assignments, all of that. And then we're going to step over into how you'll be learning. So we'll talk about some of those more experiential components. We'll give you information about next steps, and certainly we're going to allow you the chance to get connected right here today on the session with an advisor so that you have that opportunity for mentorship, guidance, support as you seek to begin this program. So with that, I now warmly have the opportunity to introduce your speakers here today, your two keynote subject matter experts and course faculty. Firstly, we have with us Professor James Barlow, who's a professor of technology and innovation management in healthcare and a member of the Center for Health Economics and Policy Innovation at Imperial College Business School. Professor Barlow, would you like to jump in and greet the audience today?
Hi, hello everybody, and you'll be hearing more from me in a moment, but I've been working at Imperial College Business School for nearly 20 years now, and I'll tell you a little bit more about myself in a moment.
So much in store here. Thank you, Professor Barlow. Rest assured, I'm going to hand over that spotlight here in just a moment. We are going to hear more from our professors. We're also joined here by Professor Loy Lobo, who's a digital health strategist and innovator at Weginik, an independent consultant and director, as well as the president of the Digital Health Council at the Royal Society of Medicine in London, and a visiting researcher here at Imperial College Business School. Very happy to have you as well with us here today, Professor Lobo. Would you like to jump in and greet the audience as well?
Hi, everyone. Looking forward to sharing what we have developed on this course with you. I've been assisting Professor Barlow at Imperial College on the course on managing innovation in healthcare. And this is a much deeper dive into what we offer in a very short elective. So looking forward to speaking to you more about this.
So much in store here for you as we highlight the ways in which this program was designed to really break down some of those barriers that you might see in a traditional classroom where you only have a certain number of seats in the room, certain number of minutes to get through a certain set of curriculum. Here in this online world, we've been able to break down a lot of that the roadblocks in space and time, making this content available to all of you from the convenience of your own location and around a schedule that works for you and in a fully immersive environment. We're going to highlight all of that here for you today as we make our way through the session. But firstly, just to set the stage, what is this larger ecosystem here that you're joining at Imperial College London? Imperial College is the future of business today. So really thinking about innovation, thinking about driving change, not responding to change, but even being the disruptors that create change in order to innovate. So how are we doing that? Here at Imperial College London, we are a global leader in science and technology, driving business and social transformation through the fusion of business technology and an entrepreneurial mindset. So really this cross-disciplinary approach, allowing you to gain the insights that you need, those business fundamentals, frameworks, and methodologies, but doing so with technology and an entrepreneurial mindset, allowing you to really bring your learning into a place of practical application in a way that's agile, flexible, and will continue to benefit you throughout the landscape ahead. So we're combining innovative thinking and insight. You're going to see that here today as you learn directly from your course faculty. We're combining this incredible wealth of knowledge with what we know works well in new technologies in order to develop real world solutions for you, so you can really bring this learning into a place that allows you to improve society, improve your organization, and reach those goals. Thought leadership here at Imperial is sought out across the globe by government officials, policymakers, global business leaders who are all partnering together here at Imperial on research projects that really are aimed, again, at helping to leave a mark on the world, to have that positive transformational change. World leading researchers you're going to learn here today from two of your course faculty here at Imperial, really helping to pioneer, again, practical solutions. So this is not a highly theoretical or conceptual program, but it's a program aimed at really helping you to make practical application of your learning. So taking this research excellence, this knowledge, and designing programs that allow that to be conveyed and used and applied in ways that are transformational. So this is a remarkable learning experience, one that extends beyond the scope of what's possible in a traditional classroom environment, one that's going to leave you with a lasting positive impact. And you can see here on the right of your screen some of the stats here at Imperial. #1 in career prospects by Guardian University Guide. The Times and Sunday Times Good University Guide ranks #1 in 2022, #1 for student experience, #3 in World University rankings. So a lot in store here for you. Rankings are rankings, doesn't really mean a whole lot. Really what you're looking for here is who are your course faculty? What is the content? How is it delivered? And is this the right fit for me? And that's what we're going to showcase for you here on this session. I'm going to hand over the spotlight to our professors now. They can tell you a little bit more about their journey to this program and begin talking about the program itself. But as questions arise, please do let us know there in the question box. We're going to be addressing those in the back end and answering them towards the end of our time together. So with that, James Barlow, thanks for being here with us. Here's your bio, sort of a backdrop here for you. I know you've worked in healthcare innovation issues for over 25 years. I'm interested in, creating that transformational change in healthcare. I'm going to hand it over to you so you can talk a little bit more about your background, what brought you to this program. Thanks again for being here.
Thanks, Marie, very, very, very much. Yes, I'm delighted to be with you this afternoon. Actually, I'm speaking to you from the west coast of Sweden, and I'm in Sweden at the moment because I'm a visiting professor at a university in Sweden, and we've got a couple of projects on the use of artificial intelligence to drive transformation and change in the Swedish healthcare system. So I'm over here this week trying to assist in doing that. And I think the interesting lesson is that it's not easy. It doesn't matter whether you're in Sweden or the UK or any other country in the world, in my experience. A lot of the issues around introducing innovation into health systems are very similar. And that applies as much to digital health as it does to other technologies. So if I could just have the next slide, please. Loy, I think we're just handing over to you now to introduce yourself.
Thank you, James, and hello, everyone, and welcome. It's been a great pleasure to work with James putting this course together for you. I bring the benefit of 30 years of experience in implementing technologies. 10 years I worked at a management consultancy, Accenture, one of the big ones. I implemented systems across 10 different industries and then decided I was going to focus on healthcare. I spent the last 20 years implementing new technological solutions in healthcare. 10 of those years were at BT. British Telecom used to have a very big healthcare business. I left BT, and for about 10 years, I've been working as an independent, investing in startups, being a co-founder of startups, and doing a lot of teaching alongside James on helping the next generation of innovators and entrepreneurs bring their health tech innovations to market. So I've got a lot of practical experience, face some of the real issues that if you're an entrepreneur, you would have faced as well. And we hope to share some of that with you on this program. More from me later. James, I'll pass back to you.
Thanks, Loy. Great. Okay. Well, look, I'm going to spend the next few slides just running through some of the detail of the course, the reasons why we set it up, what you might expect to learn from it, and then we'll dig a bit deeper into the structure of the course itself. And I'll hand back to Loy during that process, because the way we've organised the course is that he's responsible for some parts, and I'm dealing with other parts of it. So just to kick things off then, and say a few words about digital transformation and the way it's driving change and innovation in healthcare. When I started working on healthcare innovation, which was really back in the late 1990s, there's a lot of talk about e-health, the use of electronic technologies in healthcare services. And this was really seen as a way of improving efficiency of healthcare, dealing with safety and quality concerns, reducing costs. Today, we don't really ever talk about e-health anymore. We talk about digital health or digital health transformation. And the difference, I think, between the two is that now the emphasis is really on the whole-scale transformation of healthcare services, where they're organised and our relationship with them as patients or users or consumers of health products. So digital health transformation as a concept is on the lips of key stakeholders involved in healthcare services right across the world, whether we're talking about healthcare providers such as hospitals, policymakers from government, or supply chain players like drug companies. Everybody is talking about digital health transformation. And if you're interested in the future of healthcare, you need to understand digital health transformation. You need to understand the technologies that are involved, how they can be harnessed to rethink the way services are designed and delivered. But the problem, I think, is that digital transformation is immensely complex. It means different things to different people, and you'll find that solutions that work in one healthcare system may not be transportable directly to another. And this is really why we've designed this 10-week, 10-session program. It's really to give you a bit of insight into the world of digital health transformation, what it is, what it isn't, what's driving it, and where it's going in the future, and how you can use that knowledge to harness change and improvement in your everyday work, whether you work in health service or a startup or some other company. So if I could just move to the next slide, please. Thank you. As I said, digital health transformation is not easy. And one of the problems is that there are many, many different core technologies that support transformation. So understanding what those technologies are and the challenges in getting them introduced is a fundamental part of the course. We keep coming back to that again and again throughout the various sessions. So if you know anything about healthcare and healthcare innovation, there may be some lessons you can bring to the course from that prior knowledge. But understanding implementation is absolutely critical. It's no good just having the new ideas, the new potential innovations. Ensuring they are actually adopted is essential. And to do that, you really also need to understand the context within which they're being taken up. You need to understand the complexities of health systems and how to navigate them, and what that means in terms of ensuring that digital health innovation is actually successful innovation and sustainable innovation. So by the end of this program, you'll be able to say something about the key technologies associated with digital health transformation. You'll be able to say something about how they're reshaping models of healthcare going forward into the future. You'll be able to say something about the differences between digital health transformation in different types of healthcare organizations, and I'll come back to that in a moment later in the presentation. And as I said, a lot of our focus is on identifying the challenges, the success factors, and how you can really implement digital health innovations sustainably in health systems. So really this course is designed to give you an insight into the whole realm of digital health and digital health technology and transformation. And just to give you some knowledge about where those technologies are going in the future. Next slide, please. I hope you can all hear me. I just can see a message just flashed up saying, certainly for one participant, the sound quality wasn't ideal, but please let me know if there's a problem. So who's the program, who have we designed this program for? Really, we've designed it with 3 groups in mind. Mid-level business and other managers in the healthcare sector, and people who are in particular looking to future-proof their teams and their strategies, and have an understanding of digital health and digital health technologies and what it might mean for them personally. And then we're also interested in attracting clinical leaders to the course, people who know that they need to transform their services digitally. They know they need to meet all sorts of very intense challenges going forward around maintaining quality and safety and doing that in a cost-efficient way. But also there's a whole world of consultants and entrepreneurs out there who are either trying to develop solutions, develop new technologies, develop innovative products that are designed to address opportunities, or advising other people on them. And all those groups, I think, will get hopefully some benefit from this program. It helps if you have some prior knowledge of healthcare and healthcare systems and healthcare innovation. But as Marie said at the beginning, there's no detailed theory in here. It's a very practical course, and we've designed it hopefully in a way that will give you, will help you up that learning curve very rapidly, even if you're starting from a fairly low base. So I'm now in the next few slides just going to dig a bit deeper into the program and tell you what's going to happen in each of the modules. So what will we be looking at? And the way we've organized the program is really to try and take you on a journey that starts with the big picture, the core technologies which support digital transformation, the forces that are driving it, the complexity of health systems, and then drill down deeper in later parts of the course to look in some more in-depth modules which explore key aspects of digital transformation in different areas of healthcare. So we have an opening orientation module just to get everybody introduced to each other. And then after that, we begin to look at various dimensions of digital transformation in healthcare, the trends, the technologies, the reasons why innovation's hard in health systems, and where digital technology sits within that overall. So I'm just seeing another message flashing up about the sound quality. Hopefully, we're getting that sorted out. The reasons why innovation is hard in health systems and the factors that might constrain digital technology. And then in module 3, we look at platform models for healthcare, digital platform models. A lot of interest in platform models in different areas of our economy and business, and healthcare is no different. And we're seeing an increasing introduction of companies which provide digital platforms to support healthcare services. So we need to look at that in a bit of detail. Next slide, please. We then begin to unpack some of these issues involved in developing a digital transformation strategy. And these issues really run through all the rest of the course. We begin to look at what a digital transformation strategy actually is and what factors need to be considered when planning and implementing digital transformation. And we use hospitals as an example. But the lessons also run through other modules in the course itself. And building on what we've learned in Module 4, we then look in more detail at hospitals, hospital operations in particular. How can hospital organizations use digital technologies to help them improve performance, improve quality, safety, efficiency, better patient experience? What tools are available for them? What are the challenges in getting those technologies embedded sustainably in your organization? There's always too much emphasis on hospitals, I feel, in a lot of courses and a lot of reports and books and so on about healthcare innovation. And it's really important not to neglect primary care. Primary care is really where the vast bulk of healthcare is actually delivered. Hospitals are important, and you know, they're where acute care is delivered, and they're very visible. But 90% typically of all interactions in healthcare are actually in the primary care sector. So primary care is no exception to digital transformation. There's a lot going on within the primary care sector, telemedicine, for example, which is beginning to reshape the relationships in primary care, reshape the way we interact with primary care as patients, as users. So we wanted to include a session on primary care because, as I say, it's often neglected in a lot of courses or discussions about the future of healthcare. Next slide, please. Okay, so that's all very interesting, but what does it mean for you and me as patients, or you know, somebody with a patient in their family? So we have to think about the digital patient experience. So that's what Module 7 is all about. And patients are hugely varied, of course. And we try to look at what digital health means from the perspective of different types of exemplar patient. You know, it means different things depending on whether you're a frail elderly person compared to somebody who's young and digitally aware. So we need to look at that. And very important, we need to recognize the downsides that have been signaled by many people about the move towards digital health, the potential for digital exclusion, for example, of poorer, disadvantaged patients. So we look at that in Module 7. Then in the next couple of modules, we then turn to the supply chain, the supply industries in healthcare. Healthcare is not just about hospitals, general practitioners, you know, nurses, what goes on in the formal healthcare system. There's a huge supply chain supporting the delivery of healthcare services. And we picked, first of all, the pharmaceutical industry, because globally we spend around $1.3 trillion a year on drugs. But the industry has faced massive problems in the last 20 years in its research and development pipeline. It's becoming more and more difficult and expensive to develop new drugs, which of course has a knock-on effect for us as patients and healthcare systems themselves who are purchasing drugs. And the pharmaceutical industry has been going through something of a revolution, driven by advanced data analytics and new sources of data, huge databases, real world data from patient records and so on, and the application of tools like artificial intelligence and machine learning. So in module 8, we'll be looking in some detail at how digital technology and data analytics technology is beginning to disrupt the existing pharmaceutical industry and the way the traditional drug companies go about their business. I'm now going to hand over to my colleague Loy, who's going to take you through the last couple of modules and then say something more about the learning experience on the course. So Loy, over to you on the health insurance sector in module 9.
Thank you, James. So there are two more modules as part of the curriculum. We look at how digital transformation is affecting the payer industry, and that ranges from government payers to insurers to smaller players who might be given the mandate from governments to pay for healthcare on behalf of citizens. These vary depending on where you are in the world. Germany operates quite differently from Sweden, which operates quite differently from the UK. The US is different. You go to Asia, there are quite different models of how healthcare is paid for. But the challenges and the innovations are pretty much the same, and you find various levels of maturity in how payers are innovating around what they do within the health ecosystem. So we look at what payers are doing to ensure that they are paying for the right healthcare, that they're making good value choices, that they are able to provide a great customer experience for the insured population or for the managed population. They invest quite heavily in looking at fraud and against fraudulent claims, because that is a massive side industry in the whole insurance and payer market, where more and more technology is being used to detect fraudulent behavior. Similarly, governments are looking very closely at payers themselves to say, are they getting great value from the payers who are managing budgets on their behalf? Are citizens protected from the actions of some payers who might resort to unscrupulous behavior? Is there adequate protection in place? And there have been some novel uses of technology in how those protections can be monitored and enforced. So that's quite an interesting area to look at. And you'll see some interesting examples that you can go away and explore further and then discuss as part of your participation in this course. If you go to the next slide, please. The final module is on regulation in healthcare, particularly in digital health. But we cover the broader aspects of regulation in healthcare because it's important to understand the entire regulatory landscape. In the work I do with digital health startups in particular, I come across lots of founders who say, "Hey, I didn't know that my technology would have to go through all of these regulatory hurdles. Otherwise, I might not have even started." I also find people within the healthcare sector who are not aware of all of the regulatory aspects of digital transformation, and that awareness would have a greater influence on how they engage with the innovations that are happening in the sector. So this module really attempts to level that playing field for everyone, whether they work in healthcare, whether they work in pharma, or they are innovators, entrepreneurs themselves, on what are the sorts of things you need to consider and why these things are important. Uh, things like privacy, protection of patient data, transparency, having the right legal agreements in place, making sure that software medical devices go through the appropriate regulatory approvals. You need to know this at the start, because the longer you leave it, the more expensive it gets, and it could also compromise or fatally wound the innovation you're working on. So in some respects, although this is the last module in the course, in terms of your daily practice, it's probably one of the first things you need to consider when you're looking at digital innovations and digital transformation in healthcare. If you could have the next slide, please. Throughout the course, we'll make references to various core technologies that are transforming healthcare. And we'll touch on these in quite a bit of depth in module 2 itself, but we'll keep coming back to these from time to time. So expect to hear a lot about the Internet of Things, what's happening with devices, wearables, ingestibles, and how the data that's emerging from these devices being used to personalized healthcare, and which kind of feeds into the personalization technologies, where information that's being captured through phones or sensors or interactions on the web or through devices is being used to create a really personal experience of a health service, or even extremely personalized digital therapeutics or other interactions. Yeah, pharma companies are looking at it both in terms of physical and digital biomarkers to work out what type of drugs or therapeutics work for what types of individuals in what types of circumstances. So it's an extremely interesting area that is getting enriched by the application of digital technology and data. We also look a lot at robotics and automation and other related technologies which are being used to improve productivity and coordination in healthcare. By some estimates, and including some research I did myself, about somewhere between 20 and 40% of healthcare budgets are wasted on coordination issues, things that are not done in time, things that are done multiple times unnecessarily, things that are done too late, things that don't get done at all, and that has more serious consequences, all related to coordination issues, which, with the benefit I've had of working in 10 different industries, I find that, healthcare particularly has challenges with this because of um, previous years of underinvestment in digital transformation. So this is a big opportunity. And we share with you some of the technologies and examples of how some of these efficiency driving technologies can make a massive impact on healthcare and even deliver some really early benefit to support your business cases. We then look at some additional technologies as well, and it's really good to cast your eyes wide over the horizon to look at what are the other interesting things happening, whether that's um, how 3D printing is affecting the development of prosthetics or artificial limbs, synthetic tissues. Um, there's a whole interesting area on how miniaturization is affecting the creation of new devices, or indeed how physical or organ function might be enhanced or manipulated in the future. And this could, going forward, be an extremely exciting area for us to continue exploring. If you could have the next slide, please. There's one particular topic which we dive into in some detail in the middle of the course, and that's around the use of simulation and scenario building. It is often difficult to predict how a digital transformation might actually affect an organization or the organizations around it. And I've seen very frequently colleagues, clients sit with very complex Excel spreadsheets trying to figure out what, in my opinion, cannot be figured out by such means. So I introduce you to one simulation platform called Simulate. There are many others, and there are many different types of simulation. But this is an introduction to one type of simulation platform, and we use a specific case study around sepsis, which is um, a type of infection that can happen in a hospital setting and causes unnecessary death and suffering. We will take you through a sepsis simulation and show you how you can use these techniques to try and work out what should be the right interventions or remediations or risk management strategies that you could use to minimize or even eliminate the impact of sepsis in our hospital. We have an expert speaker who will take you through this, and you'll have an opportunity to try the simulation yourself. There will be a hands-on exercise. This is quite a simple simulation in some respects, but it's far more sophisticated than anything you'd be able to produce using a spreadsheet. With that introduction, we hope that it'll generate a bit of excitement for you and give you a lot of additional value in how, in your practice, in your work, you would apply such techniques to truly explore different scenarios and impacts of digital transformation in your work. We will also look at how other researchers have used other techniques beyond simulation to assess what's happening with sepsis and have an impact on it. And in a separate exercise, we'll invite you to compare and contrast some of these techniques and try and work out for yourself what might work for you and what are the choices you might want to make when you're exploring the impact or the potential benefits of a digital transformation. I'd like to hand back to Marie at this stage, who will take you through uh, various aspects of what you'll experience through participation on this course. So Marie, over to you.
Thank you so much to both of our professors for being here with us today to take us all through this program, and also for this nice segue here, Professor Lobo, as we move over into the experiential components. So we're going to take a moment now to really step over and talk about the ways in which this program is designed to be delivered. So now that you have that kind of deeper understanding of the learning objectives and what you're going to be doing across these weeks, we want to help describe for you the tangible day-to-day as well. So we follow a pedagogical approach that we call bite-sized learning. Bite-sized learning is a chance for you to learn in these brief segments of videos, these 5 to 7 minute video clips that your course professors have designed and produced for you that really describe the concepts being addressed in that week, in that moment in time. These are on-demand videos. You can watch them around a schedule that works for you at your own pace. Really kind of sink your teeth into the concepts being described. And then you'll be stepping away from those videos, those on-demand videos, and you'll be taking part in a variety of these activities here listed on your screen that are really aimed at helping you to take that learning in those brief videos and bring that into a place of practical application, really develop that thoroughly through for real world application. So there are hands-on simulations, discussion boards with your peers, role play, exercises, assignments, knowledge checks, all of that aimed at really helping you to tinker with these ideas, bring them to life, see them come into fruition here. So all of this really helping to validate your understanding of these key concepts, bring that into a place of action, reflect on your learning, really be the driver of your learning experience as you make your way through this course. And really work towards some of those tangible takeaways that we talked about, that playbook, that customized playbook that will be sort of a culmination of your learning here in the program. So you have an opportunity, if you think about it from week to week, here's how this will look. At the beginning of each week of the program, a set of content will be released. That content contains those on-demand videos that we talked about, all of these activities, discussion threads, everything you see here on your screen is released at the beginning of that week. You and your peers then have 7 days to make your way through that content around a schedule that works for you in your time zone. So again, watching those on-demand videos, being able to take part in assignments, discussion threads in an asynchronous manner, while also staying in step with the learning in the program. You will be able to learn on the go. So all of our material is accessible on a mobile or a tablet. So you can watch those videos and take part in assignments and discussions on your commute or otherwise while traveling, giving you that high level of convenience to design a schedule that works for you, but also really keeping in step with your peers as you make your way through your learning. Some of the synchronous learning components we have here, there are a couple of live faculty sessions. So if you really enjoyed learning directly from your course faculty here on this informational session, you'll have an opportunity to do that a couple of more times in the program where your course faculty are going to be coming back in to help convey their knowledge, to help discuss current events that are at play for your cohort, and to answer your questions. You'll have an opportunity to submit questions in advance to really ensure that those live faculty sessions are designed and customized around your learning needs. You also have learning facilitators. So as you think about all of the different layers of teaching and learning here in this program, you've got yourself sort of at the center, your own goals and learning objectives that you're working towards. You have your peers, that kind of layer around you. You're going to see these same themes and concepts coming to life across the globe through that shoulder-to-shoulder learning you do with your peers. So you're going to get that broadened scope of understanding, that tapestry of ideas, as you see these same themes coming to life in other geographies and other industry areas, and other types of job functions and roles. A layer beyond that, you have learning facilitators. Learning facilitators are industry experts who've been invited to come into this program and serve as your day-to-day teaching fellows or guides. They are giving you customized and individualized feedback on all of your assignment submissions, really working with you one-on-one to help strengthen your learning. They communicate frequently throughout the program. They're on the discussion boards with you and your peers, helping to push your thinking and drive engagement. And of course, they host these office hours. I'll kind of circle that here. These live office hours, weekly chance for you to turn on your audio, turn on your visual, engage in real-time discussion, and gain that customized learning. So for example, if you discover a niche area of interest, you want to dive in more deeply, gain additional resources, articles, talk about these areas of interest, you'll have an opportunity to do that during office hours, during live faculty webinars. All of the live synchronous learning, the faculty webinars, the office hours, these are all recorded just like today's session and posted in the platform. So if you have to miss a live session, you'll have a simulated live experience available throughout the remainder of the program for you to come back in an on-demand fashion. So if you think of sort of two key words that describe the program experience, number one, it's convenient. You can access it on the go. You can access it around a schedule that works for you, and it's all one-stop shop in one platform for you there. The second word really is interactive. So we've designed a blended program, asynchronous and synchronous components, giving you that highest level of convenience as well as a very high level of interaction. We believe that your learning is strengthened and enhanced with that peer-to-peer interaction, with your learning facilitators and your faculty, really helping you to design a schedule and design a learning experience that extends beyond the scope of what's possible in a traditional classroom, allowing you to learn at your own pace in real time from the convenience of your location, and doing so around a schedule that works for you. So this is a fully immersive environment. You're learning these concepts, you're rolling up your sleeves, you're applying them, you're seeing them come to life, you're discussing that with your peers, your learning facilitators, your faculty, you're moving on to the next set of concepts, and you're doing that again and again throughout your time here in the program. So it's a truly remarkable program designed, again, really to help you bring these concepts and these theories into a place of practical application so that by the time you complete this program, you're going to have everything you need in order to carry your learning throughout the future. So you do have access to this program for an entire calendar year. So you can think of it like that week 0 we learned about, that orientation week that Professor Barlow mentioned here. You have a full week to orient yourself with the platform, get to know your peers and colleagues, build out your professional network. You'll have the modules that you'll be stepping through, that sort of intensive learning that you're doing with your peers and your learning facilitators. But beyond that, you have an entire 365 days, an entire calendar year to continue coming back into the program, talking to your peers as you see these concepts being brought to life over the course of that year. So this program was really thoughtful around helping you to ensure that your learning is not, just sort of gaining tools, but really learning how to apply them, learning these methodologies and how they'll work for you. So immediately upon entering this program, you're going to gain peers and colleagues. You're going to broaden your professional network. And you're also going to be working towards a chance to earn a credential here from Imperial College Business School Executive Education. This is a formal credential, again, really helping to showcase your learning, formalize your training in this area of digital transformation and healthcare. And for those of you looking to springboard into career advancement opportunities, certainly having a credential here from Imperial College Business School is going to go a long way in helping to usher you through that process as well. So you are going to have support and help every step of the way. We want to make sure that high level of support and engagement that we talk about in the program starts right here with today's session. So the next step is to get connected with an advisor. We've made available one-on-one program advisors who are here with us live on the call today. They're helping to answer questions and they're ready to hear from you. If you don't yet have an advisor, this is a critical next step in your learning. Getting connected with an advisor is going to help get you all that you need as you prepare to begin this program. Our advisors are the experts when it comes to all of the course logistics. When are those faculty webinars? I want to make sure and get them on my calendar so I can be there. They can send you those calendar holds in your time zone so you can visualize your schedule. Any course policy questions? What happens if I'm late with an assignment? How is the program evaluated? How do I earn that certificate of completion? Are there continuing education credits? What's my alumni access? Is there a future run of the program? All of those kinds of questions. They are closest to those details. They can walk you through that. And then, of course, the registration and enrollment process. That's where you're at now. How do I get the application material together on time? Are there flexible and transparent payment options, special group enrollment pricing, other discounts to explore? They're going to help walk you through all of that. So we want to make sure you get connected with a one-on-one advisor as you seek to prepare to begin this program just around the corner. And then, of course, once the program begins, that's when you'll get introduced to your peers, your teaching team, your faculty, and the rest is up to you. So a lot in store here for you. How do you get connected with an advisor? If you don't yet have an advisor, we invite you to open up your chat box there. You're going to see a link there in your chat. So at the very bottom of your chat, you'll see there's a link that will take you right on over to the course website. There's a link there as well that will allow you to schedule directly with a program advisor. So you can either go over to the course website, take a look, download the course brochure, familiarize yourself a bit and connect with an advisor through the website, or you can use the link right there in your chat. We invite you to open up that chat box, take a look, schedule that appointment, and ensure that you have that one-on-one mentorship, that guidance and support as you seek to begin this program. There's also an email address if you prefer to connect by email. That's imperial@emeritus.org. Certainly let us know by email if you prefer to get connected with an advisor that way. And then the next steps on our end is we're going to be following up here within a day or two to provide you with copies of the recording. If you get that email in your inbox and you don't yet have an advisor, reply all, let us know, we'll get you connected. We want to make sure this is as convenient as possible for you, but that you do have that support that you need to ensure your success here in this program. So with that, let's go ahead and open up for questions. This course looks very interesting and comprehensive. Compared to other full year or 2-year programs. How does this compare in terms of quality and breadth of information? So we've talked about some of the modalities of delivery. What about the breadth and the quality? So for example, if I really want to dive into digital transformation in healthcare, is this a first step? Is this going to give me everything I need? How in depth do we go? So if I can invite our professors to jump back in, and I see Professor Barlow, you're off mute, so I'm going to put you on the spot and hand over this question to you. Any advice for students really looking to explore the breadth here of this program and what it's going to allow them to do?
Yeah, I mean, it's difficult to compare between courses, of course, because they're often trying to do different things and they're in different contexts. We've tried to give a broad overview in the course. That doesn't mean to say we don't go into depth, but we're not drilling down in huge detail in that range of topics that we talked about when going through the various modules. What we are doing, though, is pointing you in the direction of other material should you wish to dig deeper into a particular topic. And I think because the course is designed for a range of different types of user, we have to have some sort of common ground. We could have produced a course solely on, the use of digital technologies in pharmaceutical industry, for example, or implementing telehealth and remote care and what it means for primary care providers. We decided not to do that because we wanted to keep it reasonably broad, but through the various opportunities in the course, point you in the right direction if you do wish to dig deeper in any particular way. Lloyd, I don't know whether you want to add anything to that. Or...
Yeah, James, thanks. I was just recalling the discussions we had when we were formulating the course and structuring it, and a reflection that often we find mistakes are made because either leaders or entrepreneurs, come from a very specific niche or context or a specialism, and do not have a sufficient appreciation of the breadth of what they would be dealing with if they pursued a digital transformation. And so the purpose of this course is to cast a really wide net over everything that you need to consider and many of the important things that are going on, and then show you where you need to go further on any particular topic should you wish to dive much deeper into that particular subject. So think of this as a map of the territory, with some expert guidance on where there are traps and where there is some opportunities, and then you need to pick where you want to dig deeper. And the benefit of that, therefore, is it saves you hopefully a lot of time, um, going into blind alleys, or equally, it points out certain dangers and traps to you really early so that they don't catch you by surprise too late in the process.
No, I really like
Maria, I'll just add one more thing. I think we'll probably find, we don't know what the course cohort will be like, of course, at this stage, but in my experience, this kind of program where you get people from different parts of the health sector coming together, people from the provider side, hospitals and so on, meeting in a room with people from the industry, government policy and so on, you do get a lot of learning across the cohort. And even if there's a question that isn't specifically picked up in the modules themselves, you will find that there are other people on the course who may well have an answer, or be able to give you some insight from their perspective. So I think getting people together from different backgrounds is a very important part of this course, and hopefully we'll find a lot of cross-cohort learning going on.
Yeah, absolutely. Sort of a hidden curriculum here,
Yes.
isn't it? And to bring together these various groups that have touch points in the healthcare industry. And just along those lines, as we think of that range of experience, is this program going to be a good fit for folks who are already doing healthcare, already doing digital transformation, and then conversely, folks who are just sort of getting involved, getting interested, and wanting to learn the fundamentals?
So I'm sure some of these issues will be perhaps familiar to you at some level at least. I would hope that the course is going to give you time to think about the bigger picture, think about where things are going potentially in the future, and what that might mean for the NHS and your own role in the NHS. Because again, in my experience running executive programs on healthcare innovation, the people who come on them are often so wrapped up in the day job and the detail of that, they don't really have the time and space to think about the bigger picture and step back and look at how what that might mean for them. So as I say, I'm sure you'll learn a lot by attending the course. Particularly around areas which you may not have thought about, or it may be vaguely on your radar, but haven't sort of impinged on you yet.
So a lot of opportunity for folks to customize their learning, as you both have highlighted, really hone in on your interest areas. If you want additional resources, come to office hours, come to faculty webinars, gain those additional resources. Those niche areas of interest, those are yours to explore and discover here in this program. That's really going to give you that end-to-end scope of what you need in order to begin making an impact in digital transformation in healthcare. So thank you both for designing this program. Professors Barlow and Lobo, thank you for being here to tell us all about it. I'd love any final words of wisdom, words of advice as we close out the session. Maybe Professor Lobo, if we can start with you, any words that you'd like to leave us with here in our final moments together?
Sure. I wanted to say that, make use of the office hours, make use of the questions. We will come back to speak to you at some point. I work at the front end of what's happening in digital transformation, both as a startup co-founder and also a non-executive director in an NHS trust, where I'm looking at things coming from the other end in terms of, what should the NHS invest in, what we should fund. I sit on NHS panels for the NHS Innovation Accelerator, so I see a much broader spectrum of what's on the horizon for the NHS, and provide advice, guidance on how these should be adopted at scale. And so there is all of that experience that I would like to share with you on this course. I would also say that healthcare is frighteningly immature in how it really adopts technology for transformation. And what James and I are trying to do through this course is try and set the bar at the right level in terms of all the things that you need to consider, all the factors that are really important to achieve a successful digital transformation. So, no matter what background you're coming from, there will be something that would appeal to you, where you can take that, apply it in your day-to-day job, in a really practical sense.
Thank you so much, Professor Lobo. Professor Barlow, any final words of wisdom here today?
Well, I think to echo Loy, we'd love to see you on the program, and I think one of the great benefits, hopefully, will be that we have a range of people from different backgrounds and different countries as well. And although I said at the beginning, the issues are often very similar, depending on around getting digital technologies and other innovations in healthcare adopted. They're often very similar, depending on right across health systems. There are differences. So the more people who come from outside the UK, the more we can learn different perspectives from different parts of the world. We've tried to ensure that the course isn't too UK focused. We're based in the UK, but both Loy and I have worked in many, many different parts of the world. As I said at the beginning, I'm here in Sweden, working on artificial intelligence project in transforming health systems in Sweden. So bringing that perspective from other countries, I think, is something we've tried to do on the course, and weave it into the various modules you'll be going through. So I'm not sure I have anything more to say. I know, Loy, you have to rush off and catch a flight to India in a minute, don't you? So
yeah,
we should probably not delay too long. But
no worries. And it's interesting. I'm working on a rural telemedicine project over there in India, and that has different challenges.
Yeah, absolutely. Thank you both for being here. We have exceeded our time here, but very, very happy to have you both here and honored to learn from you both about this program. Thank you again for designing it and being here to tell us all about it. And to those of you who've joined in from across the globe, thank you as well for your time. An absolute honor learning shoulder to shoulder with each and every one of you. And certainly we hope to see you back in the program beginning just around the corner. And for now, we sign out. I see some thank you messages coming across here. So we echo your gratitude here, and we sign off here with a heartfelt good morning, good afternoon, good evening, and good day to all of you from around the globe. Thanks again for joining, and we'll see you soon. Bye-bye.
Thanks, everybody. Goodbye.